WCS wound care shoe. Both the upper material and the 4-part insole system can be customized to provide targeted pressure relief. The wide opening of the shoe ensures easy entry and allows it to be worn even with very bulky bandages. The hook and loop fasteners can be individually shortened as required. The lightweight outsole with fully rocker sole design has an anti-slip profile and ensures a safe and physiologically correct gait pattern. To customize the insole system, the foot is first wrapped in a protective film and the wound is located. Then, the outer edge of the wound is marked on the protective film using a marker pen. The marking is now transferred to the top sole of the shoe. To do this, the patient steps into the shoe so that the exact fit can be determined while standing. Closing the hook and loop fasteners secures the determined position in the shoe. The soles can now be worked on using the transferred wound edges. To do this, the center and outer edges of the marked area are transferred to the other insoles using a pointed needle. For wounds up to Wagner Grade 2, it is usually sufficient to work on the white sole only. For deeper wounds, both the white and the orange-colored sole are marked and worked on. The cover sole is removed first. It remains untouched in the following work steps. The areas that were transferred by the puncturing are now clearly recognizable. These are also removed. Now use a cutter to cut out the marked areas on all the necessary insoles. The cut surface should be beveled by approximately 30 degrees, means tapering downwards. This ensures optimum relief. In the final step of the handcrafting process, the cut edges are smoothed and the conical shape is worked out correctly. The soles can now be put back into the shoe one by one in the correct order. The relief zone can now be clearly felt through the low shore hardness of the cover sole. With advanced wound healing, high-pressure relief is usually no longer necessary. This is why the blue insole is now sorted further up. It is placed between the cover sole and the second sole to reduce the pressure relief. Wounds that expand upwards can also be relieved medially and laterally. In the perforated areas, the inner and the outer materials are not joined together. A needle is used to guide the cut. When stitching, make sure that only the outer layer is touched. Use a scalpel to make the cut to the desired length. Scissors are used for the cutout. Here, the pressure relief is now also clearly visible. Thanks to this quick and easy processing, the WCS from Darko is now ready for patient care and mobilization.